All right, you're live.
Okay, hi everybody, it's Dr. Robert Cohen, board certified plastic surgeon, breast and body aesthetic surgery specialist. So I wanted to bring up something that's made the news, and I was just interviewed yesterday by the Hollywood Reporter for this as well. It's kind of become another topic again, which is breast implant associated ALCL, which stands for anaplastic large cell lymphoma. What this is a type of cancer that's only been associated with textured implants, and it sounds really scary. So when the news comes out or when people hear these things, they start getting panicky. Patients who may have had this type of implant in are particularly nervous. Now, first thing to know, and before we even go any further, is that this is an extraordinarily rare problem and it's an extremely curable problem. So that's something that when I talk to patients about, we have to keep in the relative risks versus just the overall. Sure, if you had it, it'd be a very bad situation. And no surgeon wants that to happen to their patient, but it is a very curable situation, which is different than getting breast cancer, for example. So, first of all, what is ALCL? It's basically a type of lymphoma that's been seen with textured implants. It's not the same with all different textures. There's textures that have a more aggressive texturing that seems to have a higher factor, higher risk of this, and some textured implants that have a less aggressive texture, which seem to have a lower risk. But it's not just the texture. It's as far as we know right now, with all the research that we're doing as an industry and a society, it's a combination of factors. There's a period of time, usually like 8 to 10 plus years, textured implants, usually genetic component, because we see clusters in certain areas and very few cases in other areas. And there's probably a bacterial contamination event as well that could have happened either at the time of surgery or afterwards. Now, the rates of ALCL vary between different implant brands and manufacturers. In the US, we have 3 brands that are FDA approved. We have Allergan, which produces Biocell. That's the brand that's gotten in the news. There's also Sientra, which has True Texture, and Mentor, which has Siltex. So right now, the Biocell has been recalled from the FDA because the rates were the highest by far of the 3 companies. It's still very low, about 1 in 3,500, but much higher. Right now, I think Mentor's rates were around 1 in 50,000, and right now Sientra's is less than 1 in 100,000. So those are extremely, extremely low odds. And then again, the cure rate is in the high 90% just by doing a very straightforward surgery, which is taking out the implant and taking out all of the scar tissue around the implant, which is called the capsule. So just with that surgery, that usually cures people who have the problem. Now, right now, the FDA has asked that Allergan does not produce or sell more of this type of textured implant, but they're not advising that anybody gets those implants taken out unless they're having a specific problem. Keep in mind, there's millions of women around the world with textured implants in who are doing just fine, and a small handful relative to that number that are having these problems. So we need to be vigilant, we need to do the research, and we need to be very careful to protect our patients, but we also don't want people to get in a panicky situation because the odds are very low. Much lower than a lot of other things that we have to worry about, like just driving your car around town in a day is a higher risk of dying than ALCL, but we don't think about that because we're doing that every day. So anyway, that's kind of the basic information. So the bottom line is don't panic, okay? If you have Biocell implants in, you still don't need to have them taken out if you're doing well, but if you're having problems, obviously see your surgeon. If you have questions, obviously you can call your surgeon, and we're going to be available. The plastic surgery societies are very on top of this right now. Everybody is extremely proactive. We're doing a lot of research on it. We want to balance out what's safe for our patients, but not put them through unnecessary extra surgeries, and that's kind of the situation currently. So I think it's a good idea that we're taking Biocell off the market just because it's hard to justify when the rates of ALCL, even though they're extraordinarily low, are significantly higher with that type of texture than the others. We don't really have a good reason for using that texture anymore. But again, if you have them from the past, if you're doing well, you don't have to take them out. You just keep an eye on things. And the main things you'd be looking for would be a significant change in the breast, like a big fluid collection. And if that happens, the fluid can be sent and tested pretty quickly. Or you can do something like, or just watch for any significant changes in the breast. Anything that seems like it's going awry, you can always see your plastic surgeon. But for the most part, if everything is looking and feeling about the same, it's a very, very low risk. So you don't need to worry every night going to sleep that some problem's going to happen. Okay. So anyway, I hope that helped a little bit. If you guys have questions, feel free to send them in to us, and we may do some more of these videos over the next few days or a few weeks. But again, stay calm, don't worry, and if there's any major changes, call, but don't lose sleep over it, okay? And we are doing a ton of research on this, and we're going to continue to stay on top of this between the plastic surgery societies and the companies that are making the implants. So anyway, I hope guys have a great day, and stay tuned for more